Hi, Jamie Davis here at NACCHO Annual 2013 in Dallas, Texas, and I thought we'd get together and talk a little bit about social media and public health, coming right up. So we're having a good time here at NACCHO Annual, and I've got two great guys to sit down with and talk about social media, Andy Rossak and Jim Garrow, and both of you, welcome. This is a great topic to kind of kick off here because we are in the podcast studio and we've been tweeting and putting Facebook posts out there continually for the last 2 days, and it's been a great conference. But there certainly are places out there, and health departments can always do more. So Jim, before we get into that question, introduce yourself. Tell us a little bit about yourself.
My name is Jim Garrow. I work at the Philly Health Department, and I do a lot of our emergency risk communication, especially around social media. I manage our department's Twitter account, and I help out with our Facebook page. And we found it to be a great way to really get our messages out in a way that is snackable, is the new term. Instead of putting out a whole fact sheet or a whole press release, we'll take out little bits and bites and sprinkle them out throughout the day. We found it's a really great way to keep up interest in some of the topics that we're working on.
Excellent. And Andy, tell us a little bit about yourself.
Sure, absolutely. My name is Andy Rossak. I'm the Director of Catastrophic and Pandemic Preparedness at NACCHO, and before that, worked for the federal government for a while, firefighter, paramedic, and avid user of social media.
Yeah, and I think that what you just alluded to is one of the benefits of social media is engaging the public in a brand new way. And you don't have to wait until they read it in the paper or see the soundbite on the news. They can actually be getting information directly from their public health providers out there.
One of the things that we found most beneficial is we really think that social media helps us, and this is a terrible way to put it, but get around the media. So many times we'll sit down with an interview for them or get on the phone and talk for a half hour and then see 5 seconds of that show up on the news. This is a way for us to tell our whole story. And a lot of times public health people only see the bad side of public health when things go wrong. And this is a great way for us to tell the positive side of things. So.
And encourage good behaviors and do all those things that you can reach out and remind people, hey, keep this in mind the next time you're ordering a soda, order a small, or change your beverage, or whatever you want to do in the messaging.
Yeah, and it's good too for topical things. How many times has the media ignored our West Nile virus messaging? And it's on people's mind now. There's lots of rain out there, so there's lots of standing water, and this is a great opportunity for us to tell people to dump that water out. So it's helpful, I think, in day-to-day stuff, but I'm sure, as Andy will tell you, we use it a lot in emergencies too, and have found that those timely topical tweets and Facebook messages really draw interest and help boost our followings.
I remember it's been 2-3 years now when the blizzard came through hit the East Coast, the Central Atlantic, and I'm just below Philly in Maryland. You know how much snow we got, right. two back-to-back storms there. Interestingly enough, our local small-town police department of 3 police officers had a Twitter account. Our county did not, and it was that account I started following because they were the ones that were saying, hey, the emergency plan is still in effect. Do not go out on the roads unless you're an emergency responder. You shouldn't be out on the highways. And it was they were the ones who said that's now lifted. And that's how I got that information, and I'm sure I wasn't alone in that.
Well, and I think that's a good point. We have to go where people are. And we live in a world now where there's more cell phones than there are toilets or toothbrushes. So if you truly are looking to reach the public, this is one viable means of doing so, and it's low cost too. It doesn't cost anything to sign up for Facebook or Twitter. They're both great resources that you can use at your local health department, at your police department, your fire department, to really reach out to that target audience. Now, we know we're not going to get everybody, but let's be honest, we're not getting everybody now with the mechanisms we're using.
You're going to get more than you're going to get with other media sources in an additive effect alone. And it's so simple and easy to use. It's such a tool. Your experience, Andy, and in your role with NACCHO, what's the uptake on that? Are more and more health departments and more preparedness agencies in different areas using this type of social media?
Well, I think obviously the answer is yes. You see throughout the country varying degrees of uptake. Some are on social media and using it just for surveillance. So really no active engagement, but they are on there monitoring and checking in on things. Others are very robust, and obviously Jim's a great example of that. And I think, really, as Jim can attest, it's kind of a transitional time now. We've got some health departments that really understand and embrace the technology and can see the value and the benefit. But at the same time, there's a cost to that. If you're sending tweets or doing Facebook or doing all this and doing it well, then that means you're not doing something else. And since 2008, we've lost 40,000 jobs at the local health department level. So there's a lot of work that needs to go around, and some folks honestly can't justify or don't see the value in having someone play on Facebook or play on Twitter all day when they could be doing more substantial things. I personally don't think that's the right approach. I think you need a balanced approach. But we have to be honest and confront these issues head on and realize that not everybody's on board with this social media thing, because it is hard to quantify, it is hard to show the value, especially it's hard to show the return on investment. And I know we've kind of talked offline about this a few times, Jim. I think in the future you're going to see this really turn into somebody's full-time job. Active engagement, retweeting folks, answering questions, especially during disaster, because this is the medium that people are using. Twitter works via text message in addition to the apps on the smartphones. So if the landlines or the cell towers go down or have limited capability, odds are you can probably still get a text message out. And we saw that during Sandy and some of the hurricane or the tornadoes that we've had this year. It's really a viable mean of communication. But the key is you've got to be on there, you've got to be engaging, you've got to be listening, and you've got to be responding. And that again takes manpower and takes time. So I'm curious. You do such a great job. We've talked again about some of these struggles that you've had. Where are we with that, balance? And obviously your leadership is great and they embrace it and everything else. What would you say are some tips to help convince others that this is a worthwhile, venture?
Well, it's really a process. It's just a fact. Not every health department can do this right now. But I think we're seeing, especially in the private sector, this has become a priority, and it's become a priority because it at least companies that have to depend on quarterly statements and making money all the time find this to be a valuable way to do what they do. And as we start to see the stories coming out of their successes, I think that's when we'll be able to convince a lot more leadership that this is a successful way to do this. And a great example is the American Red Cross. They're a nonprofit, and they deal with disasters every single day, and they've got an entire operations center set up just around social media, just so they can monitor what's going on. And they think the return on investment is huge. They have digital volunteers across the nation that are ready and willing to stand up and actually help out online. They don't have to go to the scene anymore. They actually are able to distribute information from wherever they are and support the response effort. So I think it's a process. There are agencies and there are organizations that are making the time for this, and those are the people that are going to create the best practices, and those are the people who are going to set what the priority should be. And over time, the rest of the folks will come along. And if your health department isn't ready yet, well, that's okay. But keep an eye on the space, because this isn't a fad. I just learned a great stat the other day. Facebook will be 10 years old next year. This isn't a fad that's going away. People are doing this all the time. Another great stat that I give in my presentations is between 4 and 12% of Americans have interrupted sex to check on a social media message.
Wow. That's an interesting stat.
This is, and I don't know if it's been replicated or not, but I saw that in a study, and this is the way people live their lives. They do it on social media. And Andy makes a great point. We have to be message where people are at, or they're not going to hear our messages.
Well, and we're not going to hear them. And I think that you talk about the surveillance, those that are using it for surveillance. I think of the recent plane crash in San Francisco, and how much was going on in Twitter. The national news agencies that were trying to cover this were picking up people tweeting passengers that had gotten off the aircraft, tweeting pictures, using that as a responder, as to give yourself a picture of what you're getting into before you ever get to the scene. The power of that, if it's just available. There are opportunities there during an active event for public health to engage with the public and find out, where are these hot spots that we're hearing about, and to trying to nail it down, and contacting people they see online and an offline, directing that conversation offline so you can get more data, more information.
Well, a great example of that was Hurricane Sandy, and to me that was the social media emergency watershed event. We have pictures from inside the hurricane. We have pictures from lower Manhattan with all the lights out, and it was all because people, that's how they interact with the world. They take pictures of these things and they post them online. And years ago we never would have had this information. We never would have been able to see people stuck in the middle of raging torrents in the middle of a Manhattan street, but now we do, and we can utilize that information if we're aware of it and looking for it. A great example is Emily Rahimi, who runs the FDNY Twitter account.
Okay.
During Hurricane Sandy, she was working that night, and as is standard, their fire department has a rule that people aren't supposed to contact them that way through emergencies. You're supposed to use 911, which makes sense. It's not hooked into the dispatch system. But at one point, she got a call or a Twitter message from someone saying they needed help, they needed to be evacuated, and she directed them to 911. And he said, "I can't call out. I have no power, so my phone doesn't work, and the cell towers are overloaded with voice calls. Twitter is the only way I can ask you for help." And if we're not listening, those calls go unheeded, unfortunately.
I think that you raise an important point there in saying that social media has an opportunity to interact with people in ways beyond the commonplace. Mm-hmm. And that's a great example of how we need to meet the people where they are.
And again, I think, like anything else, you're going to get false calls to 911, you're going to get fake calls, and some of the stuff we see on Twitter, of course, it's not true, or it's not, so it does take that caveat of we have to validate some of this stuff, and we've come a long way with geolocation tags and all this stuff that we can do now to try to validate it. But even the posts that you see that are fake, for every one fake post you see, you get hundreds that are truly valid and truly an accurate representation of what's going on in the community. So I think we've kind of passed that tipping point where people are malicious and posting stuff, falsely.
Well, we've also seen too, and we have a great example from H1N1 at my department, of sometimes the community self-corrects. People will post false things or inflammatory things, and members of the community are invested in the safety and security of their neighborhoods, so they'll essentially shout these people down. We had anti-vaccine posts on our Facebook page during H1N1, and in the time it took us to approve a message to respond to them, members of the community posted and replied and essentially gave the right information in lieu of this person. So we left the entire conversation standing because we thought it was such a great example of the community supporting public health.
And it brings them in as a partnership. Right. They truly are, and that's what social media does so well, is engagement. And I think sometimes public health struggles to engage with their public effectively. So this is just a great tool to help lend to that and still take people to the traditional methods of engagement, but certainly something to be aware of. Jim, any final thoughts as we wrap up here?
Just one about, and I really direct this to public health agencies that haven't started or just struggling to get started. Somewhere in your organization there's a champion. There's someone who loves to do this and really, really wants to do it. And they may not be in IT, they may not be in communications, but this is something that they really enjoy and they're willing to spend their own personal time to do it. Find that person. That's your champion. That's the person who will do extra during the day, even though it's not in their job description, just because they think it's the right thing to do and it's the important thing to do. That's the person you should be talking to.
Great. Well, thank you. Andy, any final thoughts?
Well, I think as we look, to Public Health 2020 and beyond, this is just another mechanism that we have to embrace and have to utilize. Technology is changing ever so fast, and that means that customers, our clients, our citizens will come to expect this of public agencies. So, this is something that sooner or later we're all going to have to face. As Jim said, it's probably not going away. You've got Pinterest, you've got Instagram, you've got Facebook, you've got Twitter, you've got Vine, you've got who knows what the next thing will be. But if you truly want to be proactive and reach the public, you need to be out there doing stuff that the public's doing. And this is not your traditional media. We don't have the luxury of time in these situations, at least in emergency situations, to get messages approved ahead of time. And I think we're starting to see a shift in some of the government agencies where we're going from approving tweets like we used to approve press releases, instead of approving every tweet that goes out, you approve a person, and you trust that person. You hope that they exercise sound judgment, but even if you do mess up at the end of the day, folks are pretty forgiving. So I think it's a new paradigm that's happening. I think it's one that we should embrace, and anything we can do to increase our message and increase our outreach should at least be examined. And if it's not for you, it's not for you. But just recognize that there is some folks that are very good at this, and people are very willing to help. And I know Jamie, Jim, myself, we'd be more than happy to tell you anything you want to know about social media.
Yeah, absolutely. I'm a champion for everyone to be using it in healthcare, and so I certainly make myself always available to talk to somebody. I think, like you said earlier, it doesn't have to take an all-day job, full-time position. Mm-hmm. It can be, 10 or 15 minutes a day devoted to it. Can be enough to really get yourself a good foothold and get started. Jim, Andy, thanks a lot for being on.
Thanks so much, Jamie.
Thank you.
And I want to thank all of you for checking out this segment from NACCHO Annual 2013. Make sure you check back here for all of the other segments we're recording here. We're having a great time with lots of great information for you, and you need to check all of it out. We'll see you soon.